You brush your teeth, spit into the sink, and see a little bit of pink blood. You rinse it away and don't think twice. We have been conditioned to believe that bleeding gums are completely normal. But what if that tiny bit of blood is actually an open doorway? What if the bacteria causing your gums to bleed are right now traveling through your bloodstream, lodging into your heart arteries and your brain? Today, we expose the deadly oral systemic connection. This video is for educational purposes only. Advanced periodontal disease can lead to irreversible bone loss and severe systemic infections. Natural remedies are meant to support the oral microbiome, not replace essential dental care. Always work with a qualified biological or holistic dentist for a comprehensive evaluation. Here is the part most people never hear. Bleeding gums are not a badge of normal. In dentistry, bleeding is a symptom. Periodontal disease is an infection of the tissues that hold your teeth in place, and it typically starts with swollen, red, and bleeding gums. Left untreated, it can progress into the bone around the teeth. So when someone says, "My gums always bleed a little," what they are usually describing is not normal sensitivity. They are describing inflammation. And inflammation is the body waving a red flag. Now compare that to any other part of the body. If your arm bled every time you washed it, you would not call that normal. You would investigate immediately. Yet because the mouth has been socially minimized, people dismiss bleeding there as routine. That is the paradigm shift. The mouth is not separate from the rest of you. The oral cavity is part of the body's living ecosystem, and the National Institute of Dental and Craniofacial Research describes oral microbiome research as central to understanding both oral health and overall health. In other words, your mouth is not an isolated corner of the body. It is a biological entry point with consequences that can extend far beyond the smile. And this is why ignoring bleeding gums is such a dangerous habit. The issue is not just cosmetic. And it is not just about bad breath or a little irritation at the sink. It is about chronic inflammation, microbial imbalance, and a barrier that is no longer performing the way it should. Once that barrier is compromised, the conversation changes from, "How do I make my gums stop bleeding?" to, "What is this telling me about my whole body health?" You cannot have a healthy body with a sick mouth. That is not a slogan. It is a biological reality we have spent far too long ignoring. Now let us look at the gateway itself. Bleeding gums are not just a surface issue. They are a sign that the tissue boundary has become inflamed and unstable. In periodontal disease, the gum pocket can deepen, the lining becomes ulcerated, and that damaged pocket can create a direct portal of vascular entry for periodontal pathogens, including Porphyromonas gingivalis. In other words, the barrier is no longer acting like a barrier. Page gingivalis is one of the best studied organisms in periodontal disease and is widely described as a major etiologic agent in chronic periodontitis. It thrives in the dysregulated oral ecosystem that develops when plaque is allowed to mature and inflammation persists. So this is not a random germ floating in from nowhere. This is a highly adapted anaerobic bacterium that becomes dangerous when the mouth's ecology shifts out of balance. What makes this especially important is that the mouth is not sealed off from the rest of the body. When gum tissues are inflamed, everyday mechanical forces like brushing, flossing, chewing, or even simply living with irritated gums can contribute to transient bacteremia. Studies have documented bacteremia after routine toothbrushing, which means oral microbes can temporarily appear in the bloodstream, especially when the tissues are already compromised. That is the biological reason we take gum bleeding seriously. The inflamed pocket is not just irritated tissue, it is a microbial battlefield. The ulcerated pocket epithelium, the compromised gum line, and the local inflammatory environment all create conditions where bacteria and bacterial products can move beyond the mouth and into the circulation. This is not about dramatic language. It is about anatomy, pathology, and repeated exposure. And once bacteria or bacterial components enter the bloodstream, the body responds. The immune system recognizes a threat and mounts an inflammatory response. That response is protective in the short term, but when the exposure is repeated over months and years, the burden becomes systemic. This is why biological dentistry does not view bleeding gums as an isolated dental complaint. We view it as a signal that the mouth is sending the rest of the body. Once oral bacteria enter the bloodstream, the story is no longer confined to the gums. The immune system recognizes those microbes as foreign, and it responds with inflammation. That response is helpful in the short term, but when the exposure is repeated over time, the result can be a chronic inflammatory burden that affects the entire vascular system. The American Heart Association's latest scientific statement says gum disease is associated with higher risk of cardiovascular events. And it specifically notes that bacteria in the blood and chronic systemic inflammation are among the plausible biological pathways connecting the mouth and the heart. Importantly, the statement also makes a careful distinction. The association is real, but cause and effect has not been definitively proven. Now consider what that means inside the arteries. Atherosclerosis is not just a story of cholesterol sitting passively on a wall. It is a chronic inflammatory process in which the vessel wall changes over time. In the periodontal literature, Porphyromonas gingivalis is repeatedly discussed as a major pathogen in chronic periodontitis, and studies have reported periodontal pathogens, including P. gingivalis and even their DNA, in human atherosclerotic plaques. Experimental work also suggests that P. gingivalis can contribute to endothelial dysfunction, immune dysregulation, and vascular calcification. That does not mean every person with bleeding gums will develop plaque, but it does mean the mouth can be a biologically credible source of inflammatory load on the arteries. And then there is the brain. This is where the science becomes especially compelling, and especially important to discuss carefully. In a widely cited 2019 Science Advances study, researchers reported Porphyromonas gingivalis and its toxic proteases, called gingipains, in the brains of people with Alzheimer's disease. The same line of research linked gingipain burden with Alzheimer's-related pathology, including markers of neuronal injury. Other reviews describe the idea that periodontal pathogens may contribute to neuroinflammation and brain disease through systemic inflammatory signaling and possible brain colonization. That is not the same as saying gum disease causes Alzheimer's by itself. It means the oral systemic connection has reached the brain, and researchers are taking it seriously. So the takeaway is not panic. The takeaway is respect. Bleeding gums are not a trivial dental nuisance. They may be the visible sign of a living inflammatory system that can echo through the arteries and, potentially, the brain. That is why I do not want you to think of oral health as separate from systemic health. I want you to see it as one continuous biology. If we protect the mouth, we are not just protecting teeth. We are protecting the organ systems that depend on a stable, low-inflammation environment. Now we move from problem to strategy. In biological dentistry, we do not think in terms of destroy everything in the mouth. We think in terms of ecology. The oral cavity is home to a complex oral microbiome made up of bacteria, fungi, and viruses, and the goal is not sterility. The goal is balance. The National Institute of Dental and Craniofacial Research describes oral microbiome research as a major area of science because oral health depends on the relationships between these organisms, the tissues, and the immune system. When that ecosystem shifts into dysbiosis, disease follows. That is why simply scrubbing harder is not a complete strategy. Brushing and flossing matter, absolutely. But the mouth is not a sterile laboratory dish, and treating it like one can backfire. Some antiseptic mouthwashes can shift the oral microbiome and have been associated in studies with dysbiosis and changes in salivary conditions, which is why we should use them thoughtfully rather than blindly. The American Dental Association distinguishes between cosmetic rinses and therapeutic rinses, and even when a rinse is useful, it is still only one part of a larger oral care plan. So the real question becomes, how do we support the terrain? First, we reduce the inflammatory burden with proper diagnosis, professional cleanings, and consistent home care. Second, we support the ecosystem instead of trying to carpet bomb it. That means respecting the mouth as a living biological environment, not a battlefield to be sterilized. This is the core principle. Healthy gums come from a healthy microbial balance, healthy tissues, and a healthy immune response working together. And that is why a qualified dentist still matters here, because if there is active periodontal disease, no probiotic can substitute for deep cleaning and clinical care. If you remember only one thing, remember this. The mouth is an ecosystem, and ecosystems heal best when you restore balance, not when you wage war on everything living there. Now we get to the most practical question of all. What do we do about it? The answer is not to chase perfection. The answer is to restore balance. In biological dentistry, we treat the mouth as an ecosystem that needs support, not a battlefield that needs to be sterilized. That means the foundation is always the same: accurate diagnosis, professional periodontal care when needed, and consistent daily habits that reduce inflammation at the source. Oral probiotics belong in the conversation as support, not as a substitute. The research is promising in some settings, but it is not magic, and it is not a replacement for deep cleaning or periodontal treatment. Recent reviews suggest that certain probiotic strains may help reduce plaque, gingival inflammation, and some pathogenic oral bacteria, yet other reviews still describe the overall evidence for periodontal disease prevention and treatment as mixed or insufficient. So the scientifically honest message is this: oral probiotics may be useful adjuncts, but they are not a standalone cure. If someone wants a premium oral microbiome protocol, a product like prodentim is presented as a chewable oral probiotic designed to support the mouth's bacterial balance. The marketing emphasis is simple: repopulate the oral environment with beneficial microbes, support fresher breath, and create a healthier terrain for the gums. That positioning is consistent with the broader probiotic concept, but it should still be understood as support, not a medical cure. Now, let me be very clear. If your gums bleed, the first move is still a proper dental evaluation and a thorough cleaning plan. No supplement replaces that. But when the foundation is being addressed, an oral probiotic can be part of a smarter strategy to support the ecosystem from the inside out. That is the biological dentistry mindset. Treat the cause, support the terrain, and rebuild balance one layer at a time. If you want the oral systemic microbiome blueprint, check the link in the description. And remember, the goal is not to chase a perfect mouth overnight. The goal is to restore a healthy ecosystem, reduce inflammation, and protect the body that depends on it. This video is for educational purposes only. If you have bleeding gums, loosening teeth, swelling, persistent bad breath, or signs of advanced periodontal disease, you need a qualified dental evaluation. Oral probiotics and natural strategies are supportive tools, not replacements for professional periodontal care or medical diagnosis.